but I spoke to a program director at Family Health Office Kenya, which is an affiliate of Planned Parenthood International. We talked about them with a lot of excitement, and they have several centers across the country. They have one in Nairobi. So this is the one. This is inside the youth of very young and this is the one that spoke to Josephine Kumani. And she told me a lot of intimate details about her personal life, and how she was scared of boys and sex when she was in high school, and she went to like all girls Catholic schools where they obstinate from education. And some of her classmates were pregnant after people talked about that and things like that. And she became sexually active when she was 20, and she started using proper family planning methods once her mother found out that she was sexually active. And I spent several hours with Josephine, and she showed me around the center, and it looked like it was really fulfilling its purpose. There were really young kids from age 10, 11 to people in their early 20s, and they were hanging out, they were playing pool, watching movies, taking vocational training classes, technology classes, and I had a positive experience there. And there was also a small clinic and sexual reproductive health lectures. And so I wouldn't say, I don't think anyone would try to say that these types of youth centers are sort of standalone solutions to ensuring that young people have access to family planning and sexual health education, and Family Health Options Kenya, along with working on these youth centers, is also working with the Ministry of Education in Kenya, along with other partners, to try to integrate comprehensive sexual education into the national curriculum. And so, they're worried about sustainability of programs. This was one of the ways we were trying to institutionalize change. While we were there, there was also reproductive health groups being pushed in the country that, among several other things, was pushing for easier access to contraception for minors, as well as working on those guidelines for comprehensive sexual education. And I had also heard from a different family planning NGO, Marie Stokes Kenya, that they had just anecdotally seen a lot of young women with a lot of children. And in Kenya, as looking at national numbers, a woman on average would have 4 children over her lifetime. And I had a map of Kenya, but it was not here. So Busia is a part of Kenya that's right up against the Ugandan border. And in this county, compared to the 4 children that a woman would have over a lifetime, in this county, women would have 10 children over her lifetime. And so I was kind of intrigued by this, and I looked into an NGO that was working with child mothers. This NGO is a long name, but I'm going to call it REAP. They had a lot of programs, and one of the programs protected young children, child mothers, and young women who had been abused for facing, some sort of tragedy at home. And so these are 8 girls that I spoke to at REAP. They're girls, and they're young women, and their faces are turned away to protect their identities because they've been raped and they've fled their homes and things like that. And so I had initially thought that I would go up to Busia and this would be kind of a story about access to contraception, but I realized while I was there that this was more of a story about sexual violence and poverty influencing these high numbers of young women with a lot of children. And this is also a Catholic area, so the head of the NGO, Mary Makoka, said, contraception, abortion is out of the picture. And I had an interpreter with me when I was talking to these girls, and have like a word for contraception, so they have to like explain family planning on their own terms. And um, and it was really surprising how these women, um, how these girls and women talked about what had happened to them like it was like a totally normal part of their life. And so I'll just leave you with this quote that's on the wall behind them. Hope has two beautiful daughters. Their names are Anger and Courage. They regret the way things are, the courage to see that they do not do
All right. I'm Paul. I work with Adiba in Kenya. First off, I would like to thank everyone at the Pulitzer Center for putting together this weekend, but also for the opportunity for this fellowship. It's a unique opportunity for someone like me, who's a public health student and doesn't have any background in journalism.
Could you put the mic closer? Thank you.
Right here?
Yes.
Yep. I didn't say anything that important. And I have a script that use a lot of jargon. So, as we approach the 2015 deadline for achieving the development goals, it's clear that Kenya is not going to meet its target of reducing maternal mortality by 75%. In fact, in the last 20 years, maternal mortality has only been reduced by 0.5% each year. It means that 7,000 Kenyan mothers die entirely preventable deaths each year. And the solutions preventing these maternal deaths are well known. Most important is that births need to be attended by a skilled health professional. But in Kenya, only 44% of fertility meet the standard. In June 2013, newly elected President Uhuru Kenyatta made good on a campaign promise and declared that no charges, whatever nature, would be imposed on maternity services in government facilities. And that meant that childbirth would now be free in Kenya. This was an important step towards increasing the percentage of deliveries attended by a health professional. And it was especially important for the urban poor, such as this woman here, who lives in Mathare, which is one of Nairobi's slums, where most people earn less than $1 a day. And prior to the new policy, many of the women in Mathare slums did not have the ability to go to the hospital to give birth. So as explicit as the president's directive may seem, no charges of whatever nature, not all maternity services are being provided for free. Despite this new policy, many women from Mathare are reported being charged for bedding, bandages, and syringes because the hospitals are claiming that those aren't actually part of maternity services. And also in every single hospital that we went to, women had to pay for something for the doctor asked. The policy was, however, really effective in encouraging more women to give birth in facilities throughout the country. In Mama Lucy Kabaki Hospital, which primarily serves women from another poor neighborhood in Nairobi, births went from about 500 to 600 per month to over 900 per month. The problem is that the health system was not prepared for such an influx of patients. And there was already a lack of infrastructure and a shortage of health workers before the new policy, but this problem was only exacerbated by the free maternal care. In some of the largest hospitals in Nairobi, there aren't enough beds, so women give birth in the hallway and the floor. And the health worker shortage means that in a shift, a midwife might be the only person assisting with the 20 deliveries. And one or two nurses might be responsible for up to 40 newborns in the nursery, and that's including the NICU. That's how it is in the urban areas. In the rural areas, it's essentially irrelevant that maternity services are free. Local health centers frequently run out of basic supplies. They aren't well equipped and are almost always understaffed. In places like Isiolo, Kenya, which is in the north, there's no public transit and people live a pastoralist lifestyle. So women have to pay over $100 for fuel to get a car into the facility. This is Bashara Singh. She lives in Isiolo. She lost one of her children recently because it took over 15 hours and $120 worth of fuel to get to a hospital after she noticed bleeding. Like everyone else in her community, Bashar's only source of income is her goat herd. Many of the local health centers don't have consistent supply of painkillers or antibiotics, let alone drugs or medical expertise. The facilities are also lacking really basic equipment. This picture shows a makeshift stinging procedure in a lab that doesn't even have running water. In this same facility, they reported that they actually were charging patients for disinfectants to clean the floor because they didn't have it in their stock. Many Kenyans in Isiolo say they don't care if maternity services are free. They can't even get to a proper facility in the first place. This is Abubakar Karupi. Fortunately, he just lost his wife a few months ago because they couldn't raise $80 in fuel to get her to a facility when she started having seizures after giving birth to their sixth child. Abubakar said that instead of making care free, the government should simply focus on improving local health facilities. And there are some positive things going on in Kenya as well. Lots of non-governmental organizations are playing a key role in efforts to reduce maternal mortality. Help overburden midwives. There are several organizations conducting birth simulation trainings, which you can see here, in which overworked health professionals get training, hands-on training, managing complicated births. And so this is a simulation run by Pronto International, which is an American NGO. And they use fake blood and they have specific pants that let them simulate an actual birth so that those midwives that may have 8 women in labor at the same time properly manage each complication. There are also several organizations trying to improve access to contraceptives in family planning. Only 43% of births in Kenya are, 43% of births in Kenya are unwanted. And only 48% of women of reproductive age in birth control. Many of those efforts concentrate on long-acting contraceptive methods, like the implant, which is in here, and actually gives 5 years of protection. And the government facilities frequently have stockouts of the pill, so these are really important. So organizations like Marie Stopes International, which Adiba mentioned earlier, run outreach programs in rural areas where they offer these services. And additionally, Kenya Red Cross is also involved in a multitude of different interventions to try and make childbirth safer. In several areas, they manage community health worker programs, where community members are trained to assist their neighbors with advocacy, health education, and they even assist with a local referral system. And these tend to be really effective because they're people's neighbors, and they go in and they work with them, and they can go to the facility ahead of time if they have a pre-existing condition. And this is one of the Kenya Red Cross employees. He's running a community workshop on breastfeeding. But unfortunately, back to this, not all efforts in Kenya are positive. This is Jonathan O'Toole. And if any of you know about Scott Lively in Uganda, you will be familiar with this type of story. He's an American, and I found him in Nakuru, Kenya. And he likes to go and hold up giant posters of aborted fetuses and preach about the evil abominations of Western society. In Kenya, unsafe abortions account for up to 40% of maternal deaths, but the world average is just 13%. Abortion restrictions were slightly loosened in 2010, but the vast majority are conducted in unsanitary and clandestine locations by untrained professionals, or individuals, not professionals. And even before 2010, it required 3 different signatures from doctors in order to get abortions, but there's rarely ever 3 doctors in the location. It's believed that over 2,600 Kenyan mothers lose their lives each year due to unsafe abortions. But according to O'Toole, and this is important, maternal deaths from unsafe abortion are LGBT rights against them to protect Kenyans from Western influence. So, in closing, it is yet to be seen if the new efforts to reduce maternal mortality will be any more effective than those of the previous one. There's certainly many challenges remain. Without improvements in the overall health system, it seems unlikely that the maternal mortality ratio will be reduced anytime soon. And that's unfortunate because, like it says in the back of this community health worker
great presentation. My name's Sascha, and I was in Uganda over the summer doing a women's health-related story, cervical cancer, and I kind of went into this like Paul, my background's in public health. I don't have tons of journalism experience, and I'd never been to Uganda and been to Africa before, so I was kind of like, I don't know what to do. And so I got there just being like, okay, I studied, I knew all the facts, I was talking to OBGYNs like it was no thing, but I was still not really sure how to approach this topic. And once I got to Uganda and started talking to people, it became clear, just as our brilliant public health science journalist panel was speaking before us, that it was the characters I met that really kind of were going to be the conduits to bringing home these policy, disease kind of stories. So one of the first women I met was Nurse Josephine. She works at an HIV clinic in Kampala, Uganda's capital. And let me back up for a second. So here's the situation. So Uganda, there's a big problem with cervical cancer. Uganda has one of the highest rates, incidence and death rates of cervical cancer in the entire world. So it's the number one cancer that is lethal to women in Uganda. If you look at cervical cancer rates in the States, say, cervical cancer isn't even on the top 10 cancers that kill women. We don't see a lot of deaths from it, and that kind of dates back to the 60s when the pap smear became a regular form of preventative medicine that we go once a year, we get our pelvic exam, and that checks for HPV. We say, okay, you've got HPV, and we can kind of get rid of it. And so if you detect HPV early, you can deal with it. And the longer cervical cancer develops after 20, 30 years of having certain strands of HPV. So the whole point is you detect it early, you can deal with it. So anyway, in Uganda, the reason for why there's such a big problem with cervical cancer, the actual one underlying reason isn't known, but the risk factors that are pertinent in Uganda are well documented. So for instance, the more children you give birth to, the higher at risk you put yourself of developing cervical cancer. So in Uganda, the average number of children each woman of childbearing age has, or the average number of children a mother has in Uganda is 7. So it's high. Also, another big one is women who have HIV. Should they contract these strands of HPV? HPV, I don't know if you guys know, it's a sexually transmitted infection. The human papillomavirus. I can never say that right. I'm so glad I got it. Women who have HIV who contract the certain strains of HPV that lead to cervical cancer are more likely to develop cervical cancer than women who do not have HIV and contract the same strains. So Uganda, though their HIV rates are historically low, it's still pretty endemic to the population, and a lot of women have HIV. So you'll find what's happening more and more in Uganda is there's integration of cervical cancer screenings in HIV clinics. So I go to this HIV clinic in Kampala, and here's Nurse Josephine, a woman. She was originally, trained as an HIV nurse, but got on board when her clinic wanted to, integrate the cervical cancer screening facility, and that's what she does mostly. So she brought up she gave me some great perspectives of what it was, like to talk to Ugandan women who are, mostly, the women she sees are mostly poor, mostly uneducated, what it was like to talk to them about cervical cancer and then try to convince them to get screenings. And she said that it was, tons of women are in the clinic all the time. It's really, really hard to convince these women to come in for just for the screening, just to see if there's anything up. Because she was saying that these women are I already have HIV, and now you want to tell me I have cancer? Like, I'd rather just die, because that's just, it's too much. Cancer is sort of this new concept in Uganda, and HIV's been around, people have known about it for a long time, so it seems that a lot of Ugandan women are at least sort of comfortable with HIV. It's known what you do if you get HIV, like, it's a more familiar disease. Cancer is a really, really scary concept, so either people don't know about it, women don't know about it, or, don't necessarily want to, go through screening and figure out maybe they do have that. This sign that I found in a school in the Nakasongola district of central Uganda kind of explains this. So this was at the school I went to talk to young girls about getting the HPV vaccine, because that's starting to happen more and more in Uganda, and they have these really cute signs tacked up all over the schoolyard, like menstruation is normal, and virginity is health, and then stuff in Uganda that I couldn't understand, but this one says care for people with HIV/AIDS. And so, it's gone to the point where people, HIV is not as stigmatized as it used to be, and people are more accepting of it. Cancer is a whole different thing. So another character I happened to meet was this fellow, Dr. Israel Lutu. And Dr. Lutu is one of the only oncologists in Uganda. So to give you a bit of context, so British Columbia, where I'm from, has a population of 4.6 million. And there are 7 cancer agencies within the entire province to serve the 4.6 million that we have in our province. And then within each of the 7 cancer agencies, there's several, 6 or 7 maybe different radiotherapy machines. A radiotherapy machine is a type of sort of generalized form of cancer therapy. It's a more localized form of cancer therapy. Chemotherapy kind of, tries to rid the entire body of carcinogenic cells. Radiotherapy is more targeted to, say, like a lump or a tumor or something like that. So anyway, so in BC, where I'm from, small population, 4.6 million, but we have 7 cancer agencies that have several radiotherapy machines. In Uganda, a population of 37.5 million, they have 1 radiotherapy machine. One. And this is the fellow that kind of runs the show with this radiotherapy machine. It's this old radiotherapy machine. I got to see it. It runs off of cobalt. So it's like modern radiotherapy machines don't use cobalt so much anymore. Cobalt, so this radiotherapy machine was donated to Uganda in the 90s. It uses cobalt as its main power source. That's problematic because cobalt is it's regulated really, really heavily. So it's expensive, and also cobalt's used in bombs. So to try to get a source of cobalt into Uganda is hard for financial constraints, and also hard because there's so many checks and balances around it. Also, Dr. Lutu pointed out, thank you, 2 minutes, darn, but that's okay. Dr. Lutu pointed out that cobalt decays radioactively even when the machine is even when the machine is off for the night. So what their solution was to have to treat all the cancer patients of Uganda, and then the ones that come from Kenya, Sudan, the Congo, also get this therapy. They have the clinic open 7 days a week, 23 hours a day. So it's just people going in and out, in and out, in and out, and they get a lot done. So this was sort of more of an inspiring story. This is Catherine Awoma, one of the only women police officers in the Nakasongola district of central Uganda. I talked to her. She was getting primary. She went to go to a clinic to get advice on family planning, and and some pre-cancerous lesions were found in her cervix. So she's getting now this primary form of pre-cancer treatment called cryotherapy, where a cold probe that's made cold using gases like nitrous oxide is applied to her cervix, and essentially burns the tissues of the cervix to try to rid the cervix of the precancerous lesions. So Catherine was really great to talk to. She talked about what it was like to not be able to work anymore because, you know, the treatment's really painful. And basically how she goes about her life now that she can't work because she's getting this pre-cancer treatment. This is a woman named Irene. I met Irene a couple of times. She was involved in this trial that they were using, an international NGO was using a new method for cervical cancer screening. And she had to wait a really, really long time to get her results, like 2 months. And she was just getting like tons and tons and tons of anxiety about it. And so I talked to her about that. And then towards the end of my stay, I ran into her at Malago and she was like, I just got my results. Like, I'm positive for HPV. So that means when you're positive for HPV, you have to go for an actual cervical screen to see if there's anything problematic on your cervix, to see if the HPV has been made manifest into what could be cancerous or precancerous lesions. So as Paul was talking about, transportation's a really big issue. Irene lives outside of Kampala. She traveled for like 3 or 4 hours, had to like stop working, leave her kids at home. Her kids, who she doesn't tell anything about this because she doesn't even know how to explain it. And she gets to Malago, waits in line to get screened, but then is just told like, oh, thanks for coming, thank you for the results. Okay, so we'll schedule another appointment. So this kind of stuff happens all the time. Transportation is a huge barrier to so many women getting screened and treatment. A lot of the women, there's 0 minutes. Okay, so thank you so much for listening. If you want more, you can find my stuff on the Pulitzer website. Thank you.
Right. Hello everyone, my name is Jessica Edmond. I am from Southern Illinois University. And this past May, I have went to Ghana for a whole month by myself. Oh my goodness. And also, right to begin my topic, I want to take a moment to say thanks to the for giving me the opportunity to go to West Africa. Because it was not only a growing experience as a fellow journalist, it was also a learning experience with personal stuff. So I thank you for that. Jump right into it. My topic is pretty difficult to talk about. When people ask me, like, how was Ghana? Your topic about skin bleaching. It's pretty personal to me because it's also a touchy subject because we're talking about racism. And it's not just racism between 2 different groups. It's intro racism. That's racism within its own group. And so this picture that's up here first, this is just, I was talking way too fast. I'm a little nervous, guys, so bear with me. That instead of showing you like all the pictures that's on the website and stuff about the story, I want to show you a little bit more images that happen behind the scenes, the travel we went, and how it all came together. Okay? So the first day that I arrived in Ghana, my host family, people who were cut me from room and board, they're also they're looked upon very privileged in Ghana society. They absolutely value education. So when they came and got me from the airport, we went to the Vulture country, which is the center of Ghana, and they were hosting a ceremony they were opening up a new school. The reason I mentioned the new school and the ceremony is because Ghanaians really look up to education. Just keep that in mind. I'll flip back to that point later on my presentation. With this image here, they had a ceremony right before they kept the new school, and this to show you that how Ghanaians are really proud of their culture and they're proud of their country. Here's another image from the same example. I thought that was really cute because it's Ghana's West Africa, the sun is blazing, and the girls just protect themselves from the sun. And the reason why I mentioned that Ghanaians are so high privileged, which leads me to this this image right here. This is one of the ladies that I took a picture of, a portrait, who actually skin bleaches. Okay? Ghanaians, like I said before, they're proud of their culture. So it's really hard for me to approach a Ghanaian woman and say, hey, you skin bleach? Yes, your skin might look nice, but tell them why you skin bleach. They send a shy away because it's the pride of being a Ghanaian, being a Black woman. And God made you this way, you're beautiful, so why are you changing your skin? So no one was willing to talk to me about the subject. So I had to go through it a whole different point of view, different way. Like, hey, you look really good. What product do you use? Or stuff like that. And
they were open up to me, but when it came to the heart of the question, like, why are you doing this to your skin? It's just, we don't want to talk about it. And you can tell from the ladies that skin bleach in Ghana because this is two pigmentations on their skin. As you can tell from the image up here, this lady here has black spots. The reason why the skin bleaching cream leaves damages to the skin because skin bleaching is a cosmetic cream that has mercury chromosome inside it, which can kill the top layer of your skin, right? So you're in this hot climate like Ghana, you're putting the skin bleaching cream on your skin, then you wash it off, you go out to the sun. Now you're twice as dark as you started in the beginning because the sun is actually in your skin. And your top layer of skin is not there to protect the skin. And these are the side effects, right? Another image that I want to show you here is a young Ghanaian girl. She's in her traditional Ghanaian tribal suit. Ghanaians really don't wear this all the time. This is just a ceremony that's happening to go to. The reason why I took her picture is, besides just being a cute little girl, I'm also, while I was in Ghana, not only did I focus on adult women, I also focused on the youth because skin bleaching is such an epidemic in Ghana now that even guys, boys and girls are starting to get into this new trend of things, right? So this is just an example of pure skin. And while I was taking her picture, her mom approached her. She said, I want to take a picture with her. And I said, sure, why not? And if you look really close with her mom's skin bleaches. So this is a problem in Ghana because it's being passed down from generation to generation. This is one of the products that Biotone is one of the products that women buy for skin bleaching. One of the popular products, as a matter of fact. So the reason why I'm showing you this because you can actually buy these products over the counter. But the problem with, besides being having mercury and other chemicals in it that can damage the skin, the women in Ghana are not as privileged as the United States. So it's hard to make $1.50 a day, right? So if you're in poverty, if you're a woman, you're in poverty, you have kids, and you're trying to provide for your family, you think that you have to buy these skin bleaching products to look more fair so that you can get a better education, better occupation, just have a better life. So if you're a poor woman in Ghana, you can't afford the skin bleaching cream, which you think is your ticket out of poverty, then you make your own skin bleaching product. So the women actually buy, they get household cleaners, bleach, toothpaste, anything they can get their hands on to get rid of their dark skin. While I was in Ghana, I also documented the media that's portraying this idea that something's wrong with Black women and they need to get fixed. Skin bleaching will help. So there's a lot of billboards that's around Ghana. I went to 2 cities in Ghana. I went to the Cape Coast and also went to Accra. And in Accra, which is the capital city of Ghana, it's just everywhere. There's a lot of billboards. And I have a master's degree in journalism and in advertising. So to see this marketing, guerrilla marketing, you say, just always in Black women's face and Black women's face and saying, hey, something is wrong with you, let's fix it. When actually nothing is wrong with the woman at all, regardless of skin color. This image here, this is when I went to the doctor's office and talked to a dermatologist, and who was very rude to me. I want to take a moment to talk about this. It wasn't really rude, it was just that, because I am a female photographer, female photojournalist. So when I was asking him questions about, hey, what's this new thing on skin bleaching epidemic? He took me, he's like, what's this thing you keep asking about skin bleaching? I don't know anything about it. I'm a dermatologist. I'm like, what? Because you are a dermatologist, it causes skin cancer. What are you doing about it? Are you educating the community or anything? And he just pretty much shut me down. And this brings back the whole thing about Ghanaians. So they're proud of their culture, they're proud of their country, but if you say anything negative about Ghanaians, like, hey, Ghanaians bleach their skin, they're like, we don't want to talk about that. So they'd rather talk about the highlights of how beautiful the seacoast is, the cocoa beans, the coconuts, and the gold. But once you talk about the issues of Black women specifically, no one has time for that. But this image here is just one of the many hospitals that's in Ghana, and I thought it was really bizarre because it doesn't look sanitary at all. So And I think, it's just a personal opinion, but like, how can you educate the community if you can't even take care of your own business? If you're a doctor and people come to you for help, it's maybe a little too personal, but it just seems like if you care enough, you care about yourself, and you care about your people. But if you're just there for the money, it's very obvious. So this is one of the problems that I had in Ghana, finding people that actually were educated about skin bleaching and who actually wants to get to the community informed, saying, hey, there's a crisis and we need to take care of. One of the stories that I covered in Ghana was also about education. Education is very important in Ghana. While I was there in Ghana, I also volunteered at the school. So I got to talk to some of the students about skin bleaching. And come to find out, once again, they rather talk about the highlights of your country, right? Instead of talking about the issue of your skin. But there was one little girl who I took interest in. Her name was Elizabeth. And she was telling me that her uncle had bought her skin bleaching cream. I said, well, why did you do that? She's like, well, I had acne and T-zone, and he just saw the commercial, bought me the product, and I used it. I said, well, how did it feel? She's like, it feels a little bit. And you guys just, when you get closer, she just started. You can see like her skin started to feel like the T-zone, right? And she was like, well, my acne's gone. And I'm like, you're killing your skin. It's going to come back. You have a black T right here, right? But she didn't care about this. So it's more about vanity, fitting in with society, looking good, and paying the price. But the reason why I also mentioned about education too is because Ghanaian women feel like if they do lighten their skin, they can get a higher education. If you get higher education, you work your way out of poverty, you find an attractive male, you have light skin ladies, right? So that's the mentality behind a lot of Ghanaian women that want to skin. These last few portraits I just took, I just want to show you guys, I'm full jealous and just enjoy taking pictures. But this is an image here of two little Ghanaian girls. This is the national skin bleaching now. And in my opinion, I think it's absolutely beautiful. And like I said, I learned a lot from this trip because it wasn't so much, well, for me, I used to look at people like their skin color, but I was realizing that because we're in America, this is our history, right? After going to Ghana and looking at young little girls looking at me like I was somebody special, I'm like, wait a minute, we share the same ancestral blood. How can I look beautiful to you? You have eyes just like me, a nose like me. And it just really touched my heart because I stopped looking at individuals as a skin color. I started looking at people who are. And that's, and this, I mean, people always go from, yeah, you know, you down the side, you got your prejudice in them, right? But actually going to Ghana really helped me overcome that. Here's another image I took at the school. Something else is going to say. This is one of the images I took in Accra, just to show you what kind of environment that the Ghanaians live in. And I'm just really happy to have the opportunity to go. And if you guys are interested in my story, please look at the post on the website. And I'll be happy to answer your questions.
We have questions? Yes, and I think that we'll just call on you and we'll repeat the question. So go ahead.
So in Ghana, is this pretty much only women or men too? And then also, is this something that's becoming more of a problem, or is this been a problem for a long time?
So there's two questions. The first question is, does only Ghanaian women bleach their skin? From my research, probably about 10, 12 years ago, it was just women who started with that, but now it's pretty much taken over. Women, not only women, but men are doing it as well. And I found out too while I was in Ghana that women are putting in weight as young as 2 years old. Which is a problem because it leads to not only skin cancer, but heart failure disease, kidney disease, diabetes. It's all kinds of health risks that goes with that. So I know I was going to say education. That's what's missing with the community here in Canada. Like they value education like like the math, reading, English, English, but it's that community education that they're missing. Women in Ghana, they don't realize the severe side effects that's happening with skin bleaching. If they had this knowledge, I guarantee that they would stop skin bleaching. And what was your second question?
Is it something that's being getting worse or sort of just getting
It's getting worse. Me and Julie were talking on break. I was supposed to go to Jamaica to do this project, but some things fell through. So it's growing to the part where it's not only growing in Africa, but it's growing in other countries as well. And if I get the opportunity, I do plan to travel to Jamaica, Brazil, the Philippines to complete this research.
You talked a lot about how there's this idea that once women have better skin and all these opportunities, is that how much of a reality?
I don't think that's a good question. So how much of a reality is it for dark-skinned Africans to bleach your skin to receive privileges? You have to really know your history before you answer that, right? And generally speaking, in Black history, like not only in American history, but who's sticking Ghana? Ghana got colonized from the British from it was late 1600s. So when the Europeans that came over, they're oppressing Ghanaians. So it's this mental brainwashing that if you're white, then you get all these privileges. So now let's fast forward to present day. So Ghanaians, they don't want to be white now, they just want to be brown, fair skin, because it's a stigma towards fair skin ladies that we're more attractive, we're prettier, we're smarter. So if you're a dark skinned woman and you're like, hey, I want to be that it girl too. So you're gonna do any means necessary to fit that image. So is it true? Much as I hate to say it, can we agree? It's kind of true. It really is, and it's because it's racism. It's who's better. It's always us against them. I don't agree with it. There was a personal experience I had when I was working in Georgia. I was a fitness trainer. I went in for my first year in a class. Nothing horn, but I was pretty good. But the manager came and approached me, and she was like, "Oh, you're exactly what we're looking for. You're fair, and you could teach this class." And it's because I had the image of being a fair-skinned girl to teach other Black women how to do kickboxing, right? So right off the bat, I was only working there for a week. They put me in a manager position after that week, and I had confrontation with another female who had been working there for 3 months, who was dark-skinned, and we constantly bumped heads. So that was a personal experience that I had that really encouraged me to do this piece too. Mm-hmm. Yeah, so much as I hate to admit it, even though it's not true, because I even hate saying like, oh, is their like light skin is pretty and dark skin. Like, this is not, it's all personal preference, right? Because we're all the same. And that's exactly what I learned in Ghana, that human beings are human and beautiful. Much as I hate to admit it, but yeah, this is racism.
So this is a question for all four of you, and just like as an aside, that this is spectacular work from all four of you. It's really just phenomenal. And I hope for those of you who are studying public health, I kind of hope you jump ship and become journalists, and if you don't, at least please continue doing this work, because it's so good. Obviously, I'm playing devil's advocate because my own work is in Uganda, but I'm just curious, there are four of you, you're doing stories in public health, and you're all doing stories in Africa. And I'm just wondering, while obviously frequently the greatest disparities and the greatest problems do occur on the African continent, like, do you think that's an issue that there is such a huge focus? Do you think these same stories can be applied globally elsewhere in our own backyards? And how do you feel about that? And is that something you want to do?
For the online community, first she flattered us, then she asked why we're going to Africa.
More or less.
Public health issues everywhere in the world. And Adiba and I had a great conversation with the country director, Stokes. And she said, "What is your problem in America? Look at all of your problems." And we're saying, yep, we're very hypocritical. And I think in public health especially, going and looking at health systems abroad, we have so many problems here. It is certainly a challenge. But I guess it certainly not a model of community that going out and saying, you don't do this, you should do what we do.
Yeah, good question. And this is something I kind of struggled with as well. Like, I had when I've been studying public health and economics before public health, it was all pretty much North American, and then, you know, all of a sudden I'm going to Africa to talk about cervical cancer, and it was just like a stereotype, you know. And I totally agree with you. And it's really interesting if you look at the statistics. So I think that with public health issues, a lot of the conversation, though it's starting to pick up, really needs to also incorporate poverty. So wherever there's poverty, there's like blaring public health issues. And in North America, we have tons of poverty and inequality. So I mentioned that in North America, cervical cancer is nowhere near as deadly or as prevalent as it is in Uganda. But if you start to striate the data and you see, well, who actually in North America is getting and dying of cervical cancer, it's poor women. It's often poor Black women. And so I really, you know, think that, yeah, okay, of course we need to keep on doing public health stories in Africa, but a lot of the issues that are going on here, they're just hidden. And so I totally agree with you that public health journalism should also be paying attention to other contexts.
To answer your question, as a Black American, I realize that there's issues here that we're dealing with, and that's the kind of struggle I had in Ghana, because I'm telling myself, why am I here researching something to me is so minute? You know, Black people fight each other because one's dark and one's fair skinned. We have so many other issues to deal with, and actually, I came back upset because I was like, I'm done with journalism because I'm part of the problem. I'm like, because I'm not helping, right? But actually, I am, because I'm getting the word out. Because, like I showed in my piece, that the billboards, this media, they're portraying this image. So when I came back, I was upset, like, okay, I'm part of this problem, I need to be part of the solution. And that's what triggered my mind. So I told me and my husband decided that when I'm ready to do another project, it would definitely be in the US, because there's issues here that need to be told, especially in the Black community. I'm very passionate about things to be told. So that's what it is.
Yeah, just to add on to what Paul said, the maternal mortality rate in Kenya is really high, but it's very high in America as well. And I think if you're doing this kind of work, even just like learning about it in school or just having a little exposure, it doesn't take that long to realize that like local health issues, they're not just about, you know, people over there, they're in our communities as well.
One last thing is, you know, not to drag on neoliberalism, but seriously, neoliberalism. And I think that in conversations about public health abroad, it's important that we talk about kind of the things that the impact our foreign policy has on the health systems in these countries. And that's an important connection, because I think that the average American here probably doesn't necessarily know some of the impact of what our government does.
I have a question. I've already gone. I have a question for Adiba about the role that religion plays in these conversations, especially about contraception and religion. You mentioned the role that religion plays as a Western American. But is there any, do you know movements exist in among communities of population?
Yeah, so I'll talk a little first. Yeah, Jonathan O'Toole. Yeah, I don't think he's alone. He's highly smart, and there are a lot of strong and in the piece I wrote, a few years ago, there was a rumor in the town, and there was a rumor that there was going to be a gay marriage, and one of the few times that the religious leaders came together, Muslims and they held a press conference saying we need to get rid of gays. And then a mob of 200 people So there is influence from the physician. And I think as far as contraception, it's obviously really important. In some of those areas where I would go and, across and go to COLO or West Coast, very rural areas, you go into the health center and they say, yeah, we may not have antibiotics, we may not have this. We have lots of contraceptive usage, wall full of pill, because it was not.
A question for Sascha. I was just want to know. First, I was curious about that with June. Is it ever out of use? Is it ever out? Because you said it seems to be very much and repeat the question.
Yeah, okay, so the question is about the radiotherapy, the one radiotherapy machine in Uganda. Is it ever out of use? Because you're right, it's really heavy use. Yes, it breaks down frequently. And so when it breaks down, then yeah, it may take days to fix it. There used to be another radiotherapy machine, also a cobalt-60 radiotherapy machine in Gulu in northern Uganda, but that just flat out broke down 5 years ago or something like that. There is talk about maybe in 5 or 6 years trying to get another radiotherapy machine in Uganda. And actually there is a policy in Uganda in the Ministry of Health that addresses cervical cancer. And one big action point there is to fix the referral system, and how they propose to do that in part is to get several radiotherapy machines kind of throughout health centers in the country. How they're going to do that, I'm not sure, and no one could really answer that question for me. But anyways, yeah, it does break down frequently, and when it breaks down, it's a problem. People have to delay their cancer treatment because it takes several days to fix.
Also, just kind of, what is the success rate for treatment in Uganda?
There's no good statistics on what the success rate is, so an interesting thing is when women are diagnosed with cervical cancer in Uganda, 80% of them who actually get the diagnosis there's 4 stages to cervical cancer, and 80% of the women who actually get diagnosed are in their 3rd and 4th stages of the cancer. And so that's when it gets really lethal. And here, the recommendation would be palliative care. And actually, Uganda has a really strong palliative care system, so that's actually a pretty cool thing. But women who catch their cancers early in the 1st or 2nd stages and get a surgical treatment like a hysterectomy or the radiotherapy, the success rate is good. It tends to be quite good. But the problem is it's not caught early, and so the surgeries or therapies that happen are either not successful or they're just not really dealt with.
I have a question for Paul and Jessica. So Paul, when you talk about U.S. policy and in Africa, which is like we have impact. Jessica is a skin.
So the question for you was about what I'm talking about. Really quickly, 1980s, Ronald Reagan, structural adjustments, privatize. I think it's a pretty clear path. And I think there's a good example. A couple of years, earlier this year, there was a report out about the impact of Levi's. He would recently go to raise their minimum wage, but a couple of manufacturers, including had big factories, and so they used their lobbyists to speak in their which then spoke with English opinion. And I believe it was, don't quote me on this, I think they were going to double the minimum wage in Haiti, but they ended up only raising it 8 cents or something. It's entirely natural because of the scope. So at the same time, if we're talking about a water situation where a community doesn't have drinking water, we can't forget that our goal is to we're talking about trying to improve their life, and that's happening without that. And so I'm not a big fan of the idea that all these governments need to privatize and shrink their government, because that government has strong government is the public health services that are necessary to treat things like mental health. The answer other than improving the system.
The question was, is
There's been 18
yes. There are skin bleaching parties here in the US. A lot of, from my research, a lot of African Americans won't speak about it. And I'll speak, well, I'll give her an example. I'll give this to Dr. Garrey. You guys know Garrey, the neo-soul artist. Because she was on, I can't remember what program she was on. She was on television talking. She felt and she got a lot of complaints from the African American community. This is a woman that talks about black is beautiful, she's kind of a black woman, but now she's bleaching her skin. Her reason was because that's her choice as a woman, that's her freedom, as a woman, period. Another celebrity, we all know Michael Jackson, yeah, and Sammy Sosa. And here in America, I found out that not only skin bleaching comes in creams and pills, but now they have a new system technology that you can inject. It's a medicine into your skin, turn your skin whiter. So, yes, it's here in America. Actually, it's Western media. A lot of African American television and advertising that reflects a lot on Africa's media. So when Ghanaians, see Black Americans with the success of rolling out, they want to mimic that and using this first skin African Americans and media as the
Follow up on that. Did the celebrities talk about it?
No.
Yeah.
No.
Okay.
Follow up on the follow-up. I come from an African American family, and we have long, deep, hundreds of years roots in the South, in Virginia, and we range in skin color from very black, from very dark black to very light bright in our family line, and the darker skinned children were bathed with a cap full of bleach. That was just like an understood practice. It was not something that was discussed. It was not something that was, it was only discussed kind of like almost anecdotally, like if we have a reunion at a Thanksgiving table or something, the darker skinned, I see all my sisters are nodding, the darker skinned children would say things like, well, at least you didn't have to get a bath with a cap full of bleach, that kind of thing. And
the remarks that hey, red bone.
And it's still prevalent. This is not something that has changed or improved. If you're white, you're all right. If you're light, you're all right.
Black,
if you're black, get back. If you're brown, stick around. This is not new. It's not improved. And I think we should be talking about it more openly. And I don't think it's just an African problem. I think we know that.
Mm-hmm.
It's an African problem, and it's an African in America problem as well.
I totally agree.
I just want add on. That's not only African and American problem, that's also Asian problem. Yep. We do that frequently in China and I know Korea, Japan, we all do that. Yeah. And people, we import those injection medicines, pills from Japan and Korea, and people buying them in a very high price. So one bottle of the whitening pills actually provides you like a 30 days supply, and that's more than $200.
Just to add on to that, and there's a lot of products that come from Asia that's being imported to Africa.
Oh,
and a lot of the products that come from Asia are knockoffs. So that means they don't have good quality chemicals to like your skin. They just generic products and they pass on to us.
I have a question on that topic, Jessica, on the marketing of this and the companies behind it. I don't know if you looked into this, but are there big multinational companies that are in this market in Ghana and around the world, and how much of that is publicized?
So in a nutshell,
The big multinational companies. How does the business work? Are there people that are actively promoting this?
Okay, how does the business work for promoting skin bleaching? That I'm not for sure. So I don't want to make a false comment, but just from my personal view, being here in America and going to Ghana, it comes across very big because it's a billboard advertisement, especially in Ghana. It's pretty much everywhere. And it's not only the billboards that's advertising skin bleaching creams, there are also fair skin women billboards. So to answer your question, I'm not sure.
If Procter and Gamble were behind this, for example, you could mount an interesting campaign, an issue awareness campaign. They're trying to make money from skin bleaching content.
In India, Dove has, like, there are, at least in India, there are big companies, like major cosmetic companies that have, and they don't use bleaching or any of those words. Sorry, I don't want to steal your answer. Like, I mean, the way they do it is by talking about glow and radiance. And they talk about, they say like more bright skin.
White and white.
Luminosity. Is that a word?
To answer your question about American products skin bleaching, and that's been around for years, especially in the Black community. Yeah. And once again, it's like with the name when you buy products. I think that's buying the product too, not knowing that it had bleach. Not all of the products, but that's what the foundation was about skin tone. So
I wanted to ask you about advertising. I remember when it was Time Magazine, and in the media, you said you had your master's in it too. But when O.J. Simpson was on the cover, and they really darkened his skin, and I guess we were supposed to, you know, the criminalizing, making his skin black, and then on the flip side of that, and started kind of see Beyonce on the cover. She looks lighter and lighter and lighter, and she's like the queen, she's perfect. So,
Fact.
In the media, like whoever talking about music picture, yeah, I get it, but like, is Beyonce needs to stand up? Like, what do you think can do that?
I feel like from my personal experience, right? I mean, my personal opinion, and I just would love themselves. I mean, I can't blame my insecurities on someone else. I mean, marketing is marketing. That's their job to tell you something's wrong with your new product. I just think that a lot of girls feel this period, whether you're Black, white, Asian, you need to learn how to love yourself. And once you love yourself, it doesn't matter. You don't care what color skin you are, because you know who you are is beautiful. And I think just teaching the youth to love themselves. I can't answer that question.
As you were saying, it's just racism. It's pure, unadulterated racism. And I think that in a lot of things,
Anyway, my you could say it so wrong. And it's little by little. Otherwise, things like that. This unnoticed.
Yeah, I think I know exactly what you're talking about. But I think we're so shy because someone's going to defend there, someone's going to hurt. If you just, like you said, if someone says something racist, you say, hey, that's pretty racist.
Is there a way to skin bleach without poison? Is it all poison?
So you ask, well, it's skin bleaching. Is there another way to get lighter skin without poisoning? Right? Ask yourself this. Is there a healthier way to put at the top of your skin? That's what it's.
I guess it goes both ways. Sorry to just interject that way, but I just couldn't help myself. There's really no safe way to brown it. To brown your skin either.
right?
Yeah.
So, we have this idea of the lighter you are, the more brown you want to be, but not black, but brown. Just the right kind of brown.
But at least with tanning, what I was thinking is there's been a lot of studies on it. So women are still going to do crazy. There's always going to be someone that are going to do crazy. I don't know if you can stop that, but at least there's good data on like, this is how much your chance of cancer is going to go up right now when you step into that salon. So maybe at least it could be like regulated enough and the science of it.
I think there is data about mercury. Right?
But maybe if it was more out there, like it's very easy for me to figure out with tanning, but I feel like the realm of bleaching seems to be, at least from what you say, all over the place, homemade. I mean, if there was like good statistics on which one was maybe like, but yeah, how bad things are out there. I don't know if that's true. But
I guess it's
I feel like I know less about it.
people don't want to talk about it.
I was actually a much less productive tanner than this. It was at the Filipino Women's Network in Filipino and in San Francisco, and it was women who kind of made it, and the dermatologist on the panel who was advocating. Came out of her mouth that she had pioneered this technique for Asian women, and she said, if you are light skinned, you can attract an American man, and he will marry you, and you will be successful. So this idea that like having lighter skin is a ticket to privilege is not exclusive Ghanaian or African. I mean, women literally, like Asian American women, literally have conversations like that. Or Filipino women have conversations like that. All Asians. Where they say, well, if I am light skinned, then I'm more likely to attract a successful, fair skinned man. But she was advocating this technique to bleach our skin so we could get a fair skinned, successful man. Like that was the other part. You want a successful man. I just was like,
The way going to rich is kind of wild in China.
Yeah, I think just to like kind of play on her point is that it kind of goes both ways because like I'm constantly putting on self tanner and trying to be darker, and there's a whole industry of tanning salons and tanning products, and oh, try this self tanner, and marketing on this one doesn't smell, but whatever. And so I think that it goes both ways. Like you're never happy with what you are. Like I want to be darker, someone else might want to be lighter, and I don't know. I think that there's like both sides.
Let's all love ourselves.
Is there any economic or educational benefit if you're white to darken your skin to be tan? Is there any direct benefit the way there is if you are lighter?
I think that it's more like you're just considered, I have a friend who's so pale, you can see her veins, and she's embarrassed. And people look at her, funny, and they're like, "Oh, you're so white," and they make fun of her.
But it's purely aesthetic, right?
Well, I think you can make an extensional argument that white people who are tan can afford to go on vacation.
Yeah.
You can make that kind of socioeconomic argument, but it's clearly not of the same ilk of the color who are dealing with.
Right.
It's really rooted in, like you said, not being happy with yourself as a black person. My husband is a black man in a super, super successful position, and he has constantly been ostracized in white communities just because of the color of his skin. And so my dad's half, and my brother and I are in the corner, and we're not black or anything, but it's a matter of standing up for the black man.
There was a really interesting article just recently. Check it out. It's about this book that a historian wrote about history of passing. And and it's about has a story of like there was a family in Virginia, and the father was a practicing physician and successful and well respected in the community, and then he tried to serve in the military, and he didn't pass the physical because it came out that he was black, and they basically outed him as a black man, and his whole family, a family of, I guess, of black people, but the children didn't know that they were black because the benefit passing was so big.
Well, this happened to Thomas Jefferson's relatives.
Yes. So anyway, you should read
But
this.
anyway, we are going to have to end here on that. A great discussion. So we'll take about a 5-minute break. Everybody should stand up.